Professionalism and Civility in the Nursing Practice by
George Guitao,
Kat Del Castillo,
and Jasmine Thomas.
What is professionalism? Professionalism is defined as actions, behaviors, and the attitude of an individual that are reflected of the core values, ethical principles, and regulatory guidelines of the profession, according to our ATI module, Professionalism and Leadership. Professionalism, there are inner processes and outer processes that contribute to professionalism. The inner processes include accountability, capacity for reflection, compassion, decision-making, empathy, evidence-based knowledge, honesty, integrity, self-awareness, trustworthiness. Outer processes include adherence to code of conduct and ethics, clear communication, client and family-centered care, continuing education, health advocacy, legal compliance, professional organization membership, recognize personal and professional boundaries, reflective tasks, respectful behavior, self-care, and sense of professional community. What is civility? Civility is behavior that shows respect toward another person, makes that person feel valued, and contributes to mutual respect, effective communication, and team collaboration, according to American Nurse.
What does professionalism look like in the workplace? Teamwork, effective communication, and respecting boundaries. What are factors that can affect patient care? Lack of communication and miscommunication, not following policy and procedures, delay in patient care, medication errors, ineffective teamwork, hostility, stressful work environments can cause unsatisfactory patient care. Uncivil encounters such as aggression can result in life-threatening mistakes, preventable complications, and patient harm.
Our scenario is Ben, the LPN, and Amir, a new grad LPN, are working at a long-term care facility. John Doe in room 204 has had their call light on for 5 minutes. Ben's patient is John Doe, but he is nowhere to be found. Amir is coming up on the hallway and notices John Doe's call light, so he decides to check on the patient. Amir says, "Hi, I'm Amir. How can I help you?" John Doe, "I haven't had anything to eat or drink. Can I have some crackers and some juice?" Amir, "Sure, let me find your nurse." Amir goes to look for Ben, but Ben wasn't available, so Amir gets John Doe a snack and a drink.
Ben comes back and is doing his rounds to give his PRN medication to John for anxiety before he is transported to his scheduled surgery and finds John Doe finishing his snack and drink. Ben is shocked. "Where did you get that?" The patient then says, "Oh, I got it from Amir, the nice nurse." Ben yells for Amir to come to the room and confronts Amir to confirm that he gave the patient nourishment. Amir responds, "You were nowhere near when I answered the call light and I did what the patient asked." Ben gets defensive and yells, "Why didn't you check his chart? He is scheduled for surgery and now it will be delayed." Amir then says, "I'm sorry, I am a new nurse and did not know." Ben then says, "My apologies. My initial response was wrong. I should have been more professional and this should have been a teaching moment instead of insulting you. This is a critical thing. As an experienced nurse, this is one of the first things that we will always check. Let me show you the next steps in this process when things like this happen." How to solve conflict. Acknowledging that there are different ways to give adequate care and not everyone will do every task the same way. Remembering the patient's state of health and care are top priority, and the best way to handle conflict would be to approach the matter privately outside of patient care areas. Following the chain of command when conflict seems to need the opinion or delegation of leadership.
do's and don'ts of professionalism. Do's: talk to coworkers respectfully in a decent tone, maintain ethical standards, teamwork, good constructive criticism. The don'ts: do not yell, do not assume, do not make your teammates feel inferior to you, do not gossip. How to make a difference. Be a positive role model in healthcare by showing characteristics of compassion and empathy with co-workers, being open to healthy communication among team members, working as a team to make sure the patients are getting the adequate care and necessary to promote healing and proper care. Each team member, including nurse managers, charge nurses, and staff nurses, being able to take accountability when when steps in patient care are missed or not done properly. Be mindful of the changing factors and cultural, religion, and diversity in the workplace and with patient care. Conclusion: nurses have been trained to be skilled problem solvers while being able to adapt quickly, professionally, and effectively in the healthcare setting.